Rios joining us on the BT Couch, family physician and medical director for the Dudes Club. And first things first, tell us about what the Dudes Club is and the great work that's being done on the East Side.
Thanks. So the Dudes Club was started in 2010, the Vancouver Native Health Society. There was a big need in the community for the guys to get access to programs for them, because there's a lot of programs for women and children in the downtown East Side, and men tend to be neglected when it comes to health promotion programming. And so they brought this big need to us, and we tried to facilitate a health promotion program where the guys meet every 2 weeks. We talk about, really interesting health topics and get the guys to share their stories and support each other. And it's amazing to see what happens when a group of guys get together, just talk about casually about what they're experiencing and move on in their life in terms of accessing and being more proactive about their health.
Well, the dialogue, no doubt helping people on the downtown East Side, but the checklist when it comes to men's health issues are really universal. And let's start here, the idea of mental health, the key symptoms for men that you're looking for, and a great starting point if you are suffering.
Well, the big issue with mental health for men especially is the stigma and discrimination. A lot of guys, because we're not expected to show emotion, to feel emotion and to show weakness, that's a societal pressure that men have. So many men suffer in silence as a result of that stigma. So it's just a question of breaking that silence, having conversations that are open and honest and supportive with guys so they can take action. Many guys, 1 in 5 men this year will experience a mental health issue. That's our brothers, our fathers, our grandfathers, co-workers, teammates. It's a community issue as much as it is a men's health issue. And initiatives like this where we're able to promote mental health in a positive light and show that it's actually a sign of courage and proactive, effort to address their health, because men are always focused on their physical health. But for example, at the Dudes Club, we use the Aboriginal traditional approach to health, which is mental, physical, emotional, and spiritual. And if we don't take care of those other aspects and only think about our physical, then we're not in balance, And so our elder, Henry Charles, makes sure we honor those traditions.
It's a valuable holistic approach on that. What about the risk factors when we talk about cardiovascular disease?
Yeah, so for heart disease, it's a big deal for men and women. 9 out of 10 people who suffer from cardiovascular disease have a preventable risk factor. So that's a question of getting into your doc when you're in your 30s and 40s, getting that basic screening for blood pressure, cholesterol, diabetes check. These are all things that can be addressed when we're establishing our lifestyle, kind of habits that will have an impact 30 years down the road. So we always encourage guys in their 30s and 40s, they think it might be too young to come in and check it out, but it's really important to connect with your doctor at that point, for sure.
Going above and beyond the annual physical, are we saying, with these checkups?
Yeah, the annual physical is a nice routine to kind of be in, to at least just check in with your doc. A lot of people don't actually need that. The studies have shown that after 50, that becomes a more important requirement. But in 30s and 40s, you want to get in and check with your doc, make sure you don't have an inherited cholesterol issue or something else that's hiding, beneath the surface. And it's just a quick visit.
And the prostate cancer screening, that's another big one for the guys.
Yeah, that's a big deal. And we're really lucky to have Dr. Larry Goldenberg, who's a world-class prostate expert, supporting us at the health fair today. And as far as prostate cancer screening goes, it's a question of just getting that conversation going with your doc by the time you're 50. If you've had your father or brother have a history of prostate cancer, or if you're a man of African ancestry, you're at higher risk of prostate cancer. So we try to recognize those risk factors and get guys to come in a bit earlier for screening. Conversation about the blood test and the prostate exam.
Well, it's really getting proactive. And before we get to the details about the health fair, I want to get your comment on the right to die conversation we were having earlier about doctor-assisted suicide being legalized here in BC. What do you see in terms of the reality in the future of something like this?
Well, in general, it's a difficult topic, that's for sure. There are other jurisdictions in the world that have instituted laws for physician-assisted suicide, and there's been some movement, of course, in Quebec in that regard. And it's an important conversation for us to have. I think the medical community is moving in a direction to open up that conversation. And the Canadian Medical Association actually recently loosened their stance on physician-assisted suicide so that conversation can happen. And it's a big issue for us to discuss and see how we can move forward. It's a big, complicated issue for sure.
No doubt. We're getting some great comments on social media. Keep those coming on that all-important topic. And the health fair happening later today. Details, 1 p.m. to 5 p.m. down in East Hastings?
Yeah, at Vancouver Native Health Society, 449 East Hastings. We usually get about 100, 120 guys come out. This is our third annual event. And there's screening stations for oral cancer, for prostate cancer with Dr. Goldenberg, blood pressure, height and weight screening, and mental health screening. And then at the end, a big barbecue, a big feast that's kind of presided over by our Musqueam elder. And guys will walk away with a big bag, t-shirts, hats, promotional stuff, and things they need in their daily life, hygiene stuff. So we usually get a good turnout, and it's a good kind of open house for our Dudes Club to promote what we're doing, and an opportunity for us to further our work with Movember Canada. We were recently funded on a grant as part of a 5-project network at UBC led by Dr. John Olaf to address depression and suicide among men. So we'll be doing our surveys there for the program evaluation of the Dudes Club.
An important sense of community happening. Listen, Paul, thanks for coming in.
Thanks a lot, Ria.